Happy November, everyone. As beneficial as our time is on the massage table, another critical component to healing is daily self-care. In this video, I'm going to show you how to treat your whole body using nothing but a tennis ball, as well as introduce you to a couple of other of my favorite self-care tools. First, we have our trusty tennis ball, which can be found at any local sporting goods store or even a pet store. Second is my double lacrosse ball, which is a good alternative if you're looking for something with more intensity. You can also get just a single lacrosse ball. Next, we have the 6-inch inflatable all ball. This is a great option for psoas and hip flexor work, or if you find the tennis ball to be too intense. This smaller spiky one is called the foot Rubz. This is a powerful tool for plantar fasciitis, the forearm extensors, thumbs, and breaking up scar tissue. Last, we have the still point inducer, which is a craniosacral technique meant to temporarily pause the craniosacral rhythm to enhance the immune system efficiency, reduce stress and headaches by easing chronic musculoskeletal pain. I will provide links as to where you can find these self-care tools at the end of the video. All right, let's get started. We are going to roll ourselves out, starting on the feet and working our way up. We'll start with our tennis ball. This is really helpful for anyone with flat feet, plantar fasciitis, or after a night in heels. For more intensity and targeted focus, we can use our foot Rubz. Let's move on to the calf. Again, we'll start with using the tennis ball, making sure to point the toe from side to side, hitting the lateral and medial sides, as well as the belly of the muscle. Even using the ball to create some cross-fiber friction. We can turn over and apply the tennis ball along the outside of the tibia, hitting the parietals. If a tennis ball is too intense, you can use the all ball, or if the opposite is true, then a lacrosse ball is what you're looking for. All right, time to start loosening up those hips. The pelvis is the steering wheel to the body, and anytime it becomes out of balance, the rest of your body is forced to follow suit. We want to make sure we get those hip flexor attachments doing small circles and side-to-side movements and sitting and holding in the really tight spots. From here, we can turn to our side, going around the greater trochanter into the TFL and down the IT band. Again, for less intensity, use the all ball, and for more intensity, use a lacrosse ball. While we're here, let's release the psoas. The psoas is a crucial muscle and has biomechanical and postural functions, and most often a major contributor to low back pain. The psoas is a crucial muscle and has biomechanical and postural functions, and most often a major contributor to low back pain. I like to use the all ball for this one, but if you can handle the tennis ball, by all means, go for it. You want to locate your belly button and move approximately 3 inches to either side, and start with the ball there and work your way down into the pelvic area, moving very slightly from side to side and stopping and holding when you find an area of tension. Let's turn over and complete our hip routine. We're going to take our tennis ball and roll along the edges of the sacrum, hitting the deep 6. Next, we're moving on to the back. I like to use my tennis ball against a wall for this because I feel like I have more control of how much weight I'm using for my low and mid back. Make sure you can get down into those SI joints. Little circles feel nice in this area. Again, anytime you find a sweet spot, stop and hold it. Readjust the tennis ball as needed to move up the back. After rolling out my rhomboids, I return to the floor so we can address the rotator cuff, pecs, and lats through the armpit. I like to start at the bottom and work my way up with a side-to-side movement. From a prone position, we can really get into the pectorals. This can be a sensitive area if you have a lot of tension built up or work at a desk, so please listen to your body and use what therapy ball feels right for you. To release the levator scapula and upper trapezius, my double lacrosse ball is what I like to use, but we're going to start with our tennis ball. Here, I like to raise the arm to pin and stretch. Cross fiber along the paraspinal muscles can provide us with feelings of safety and deep relief. Shrugging the shoulder and doing circles is also helpful in this position. The foot Rubz ball comes in handy again for the forearm extensors. This feels great if you work a lot with your hands or do a lot of typing. We can even use it to get into the thumbs. Last, we have our still point inducer. Place it under your head in line with the top of your ears and allow the full weight of your head to completely rest. Close your eyes and relax. Thanks for checking this video out. I hope y'all got something out of it. Feel free to reach out with any questions, and I look forward to seeing you next time on my table.